Hello, I'm Brian Haug, President of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Market News Network. This week, AJMC and the Patient Access Network Foundation hosted a roundtable in Washington, D.C. on the economic hardships that patients face as cost-sharing burdens increase in cancer and other therapeutic areas. Economists, patient advocates, health policy experts, and others joined the discussion, which featured case studies that were part of the PAN Challenge, a project that seeks solutions for what rising out-of-pocket costs mean for patients. This month, AJMC will publish 2 winning challenge grant papers in a special issue. To read more about the discussion and the PAN Foundation, visit ajmc.com. There was more news this week on the high cost of drugs. On Tuesday, AARP issued a report that found retail prices for drugs commonly used in Medicare are rising at 6 times the rate of inflation, which is putting a heavy burden on seniors. Seniors must pay more out-of-pocket for prescriptions, but because inflation has remained flat, their Social Security payments have not kept pace. In fact, there was no increase in 2016. AARP found the average annual cost of the 622 drugs commonly used in Medicare was $11,341 in 2013, more than twice the average cost from 2006. Most of that increase is due to skyrocketing costs in specialty pharmacy, which includes drugs for cancer and hepatitis C. Unfortunately, patients and health plans may be paying for cancer drugs that go to waste, according to Dr. Peter Bach of Memorial Sloan Kettering Cancer Center. This week, Dr. Bach and authors from the University of Chicago published a study that found many doses of cancer therapy are much larger than necessary, and what is left over is thrown away for safety reasons. It will cost the healthcare system $1.7 billion in 2016, the study found. Dr. Bach said, "This is due to decisions about how much drug companies decide to put in each dose vial. They almost certainly realize how these decisions translate into revenue." CMS this week issued final rules for the 2017 health insurance marketplaces, which include new provisions to limit surprise bills for consumers. However, some aggressive proposals to impose minimum provider network standards were left out. Open enrollment will begin November 1st, 2016 and end January 31st, 2017. Health and Human Services Secretary Sylvia Burwell announced a pledge between major health IT developers and the federal government to improve the flow of information. The pledge, which covers companies that provide 90% of electronic health records used, includes 3 core commitments for better consumer access, improved transparency, and a plan to implement federal standards for electronic health records. Next week, a New Jersey Senate committee will discuss 3 bills that would increase transparency in creating tiered rating systems, following the controversy over the creation of the Horizon Omnia plan. Most of New Jersey's Catholic hospitals have sued over being left out of Omnia's preferred tier. AJMC asked Sister Patricia Cody of the Catholic Healthcare Partnership of New Jersey to discuss the key parts of the legislation.
On Monday, there's going to be a hearing in the Senate Commerce Committee in regards to a package of bills dealing with Omnia. And I really applaud the leadership of Senators Vitale and Senator Gill in regards to this. They certainly have taken up the challenge. They certainly have been working with various stakeholders to try to come up with some legislation that provides the following. One would be transparency. Transparency is very, very important in the industry. The second item is to look at what are the standards that we're trying to make an evaluation as to how someone comes into a tier network. And then what weight is given those standards. And then as well as the fact that an opportunity for all stakeholders to come to the table and to present their cases. So I would applaud the efforts that are being made on the legislative front. Certainly it's a bipartisan effort, but we really need to evaluate what happened and how we can move forward. And I believe that this legislation will provide that.
New Jersey is the location for our upcoming meeting, Patient-Centered Diabetes Care, which takes place April 7th and 8th in Teaneck. For more information and to register, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Brian Haug. Thanks for joining us.